again. We're at this marvelous 7 Days Adventist Hospital to talk about diabetes. So, what is diabetes? That's the main questions many people have been asking for years. So, we're here at this marvelous hospital to talk to some nurses on how diabetes comes about. We'll be back for more. Please stay tuned.
Good afternoon, and thank you for accepting to conduct this interview with me. First of all, I would like to ask, what really is diabetes?
There are two types. Type 1 is where your ability to produce a hormone called insulin is impaired by either, say, a virus or sometimes they don't know the reason, but your body does not produce insulin. Type 2 is something that can be controlled by, diet, exercise, things like that. Type 2 is when your body is not, it does not react to insulin the way it is supposed to react anymore because either, you've been taking in too much sweets or too much carbohydrates and things like that. Both types, when you're diagnosed with diabetes, your body ability to use glucose is impaired because it's usually related to insulin. Because so for somebody like who has many family members in the family, so say your dad, your mom, your grandmother, your grandfather all have diabetes, your chances of getting diabetes is much higher than everybody else's. So it depends on genetics and it depends on diet. It's both.
So, what are some symptoms of diabetes?
Okay, so like most people, when they first realize, oh, I have diabetes, or you see those people, they're usually a little bit overweight. Not all, but most. Okay, it doesn't. You don't have to be overweight to have diabetes, but they'll usually do like a urine test, a blood sugar test, and you see that the blood sugar test before they have before they have eaten, even then the blood sugar is high or they have protein, or sorry, sugar in their urine, um, or they have ketones in their urine because ketones is a waste product of muscle breakdown. So when your body cannot take in glucose as its energy, it starts eating up its own muscle. So you'll see ketones, but that's if it's very advanced.
So, what if you haven't yet, as you haven't yet found out that you have diabetes? How some symptoms that, yeah, like when you don't know yet, and then you start feeling, what are some symptoms that you feel that
It's
is diabetes?
Most people, that's why it's so difficult because a lot of people will not know that they have diabetes until things like, they come in and they're like, I have heart problems, I have kidney problems, blood sugar. Can you imagine just all of your organs, your blood vessels? There's much sugar in your blood. It's just soaking in sugar. It's not good for any of your organs, right? So usually you'll start seeing like people come in, there's kidney problem, or they have cuts and they don't heal fast, things like that.
So, how is it treated?
It's treated.
Lifestyle factors is a very big way of treating diabetes or managing diabetes. Eating healthy, not taking in lots of sugar, lots of oil, unhealthy foods, mainly sugar, but also carbohydrates. Simple carbohydrates like pasta, white rice, white bread, it turns to sugar in your body. And so it can also increase your blood sugar and you can have problems with diabetes. Making sports, exercising often, making sure you are at a healthy weight is a very important part of managing diabetes. You can also take drugs to help manage the diabetes also.
That's in of that's diabetes in our community, the impact of diabetes in our community.
I think a lot of it, I think there is it's our community here is lacking a little bit in education in terms of letting people know about diabetes. Um, Culturally, the diet, there are so many delicious foods here. but a lot of it is heavily, carbohydrate based. There's a lot of beer, alcohol consumption, and that really affects, your body and your health, and it does increase your risk. So I think that there could be a lot more education done in the community. Well, there are some places, like, it's hard to get statistics exactly, but um, diabetes increases your risk for cardiovascular diseases and like by about 50% than normal people. Um, in terms of diabetes, in developing countries, it's gradually increasing more and more. Um, I can't remember what the number is, but within the next 30 years, there will be a huge increase in patients with diabetes. Um, and it can be controlled well, but through dieting, exercising, things like that. But um, I don't, once your body is it's not as reactive, sensitive to insulin, then at that point all you can do is diet and being healthy and things like that will really help. Like, you do not have to be on insulin, you do not have to be on drugs. Okay, it can just, lifestyle changes is such a huge thing. It'll take more, but everything in moderation.
What percentage of people in Cameroon suspect to diabetes or blood cancer?
I don't think I've seen enough to
So,
that's something definitely, I don't know how accurate the research would be, but that's something if you look
Okay, ladies and gentlemen, we come to the end of this interview. Thanks for watching. Thanks for your time. You've been the best audience. And for more info, you can visit us on our website www.diabetesandcamera.wordpress.com. My name is Veronica, and remember, diabetes is deadly. Alright, guys.
So high, we're still climbing. Even here inside these walls, breaking each other's hearts, and we don't care.